Hello, and welcome to Public Health 101, an introduction to public health. This training is designed to provide a foundational understanding of what public health is, why it matters, and how it functions in our communities. Today's presentation will cover several core topics, including definitions and key terms, a historical overview, the public health approach, core functions and essential services, stakeholder roles, and the landscape of public health in Minneapolis. By the end of this training, you will be able to define public health using key terms, understand its historical development, describe the core public health approach, and recognize key stakeholders and services at both national and local levels. Let's begin with some definitions of public health defined by some well-known public health agencies. The CDC Foundation defines public health as the science of protecting and improving the health of people and their communities through healthy lifestyles, disease prevention, and infectious disease control. The American Public Health Association adds that public health is about promoting health and protecting people, using science-based, evidence-backed approaches to ensure safe environments for living, learning, working, and playing. Although these definitions have minor differences from each other, the similarities to note are that both definitions include the protection of communities and the goal of prioritizing their health and well-being. Here are some key terms that will guide our understanding. Determinant, a factor that directly influences health outcomes. Some examples are access to healthcare, income level, educational opportunities, and neighborhood safety. Health disparity are preventable differences in health experienced by disadvantaged groups. Some examples are higher rates of chronic diseases in certain populations and premature death. Health outcome, a measurable change in health status. Examples of this is increased life expectancy, decreased rates of heart disease, and improved mental health. Clinical care refers to prevention, treatment, and management of illness. Epidemic or outbreak are cases of illness exceeding normal expectations. Trauma-informed care is a culturally competent, strengths-based approach that acknowledges the impact of trauma. Stakeholder is anyone affected by or interested in public health outcomes. We will now dive into the history of public health. You will learn about the role of public health and its advances in 4 different areas. Public health has deep historical roots. In 500 BCE, the Greeks and Romans practiced sanitation by including aqueducts, sewers, and public baths into their public sanitation systems. The 1848 Public Health Act in the United Kingdom was a landmark piece of legislation, particularly in response to the unsanitary conditions prevalent in the Industrial Revolution, marking the early structure of public health policy. In 1970, the Environmental Protection Agency was founded through the executive order by President Richard Nixon to protect environmental health and respond to the growing public concern about environmental pollution. Next, we will explore pandemics. Pandemics are epidemics or outbreaks of disease that spread far and wide, affecting the populations of multiple continents. Influenza, or the flu, has caused pandemics many times during both the distant past and recent history. Almost a century ago, the Spanish flu infected 500 million people across the world, including remote Pacific islands and the Arctic, killing 20 to 50 million persons. More recently, the influenza pandemic in 2009 infected persons in 214 countries, causing almost 19,000 confirmed deaths. Preparing for and controlling the effects of influenza will likely remain top priorities for public health. Historically, polio was a common and highly feared disease that caused severe illness, including paralysis and death among thousands of people each year. Thousands of people lined up to receive the polio vaccine after it was introduced in 1955. An initiative to eradicate polio was launched in 1988 because of outbreaks in more than 125 countries. Today, polio exists in only a few countries. During the 1980s, human immunodeficiency virus, or HIV, emerged and spread rapidly across the globe. Public health has responded to this pandemic by developing new ways to diagnose and treat those who are infected. New infections of HIV are down 20% over the past 10 years, which is a sign that public health interventions are successful. The third area we'll explore is public health's role in preparedness and disaster response, both for natural disasters and human-made threats. The use of biological warfare to infect people and animals goes back centuries during the siege of Kaffa in the 14th century AD. The attacking forces used plague as a weapon of war by hurling plague-infected corpses into the enemy's city. Their actions started the first stage of the Black Death, or also known as the Plague, among Europeans. In the immediate wake of the terrorist attacks on September 11, 2001, public health workers were on the ground at the World Trade Center and the Pentagon, conducting surveillance to identify outbreaks of diseases or other possible health conditions resulting from the attacks. Public health workers closely monitored the health of first responders, city residents, and environmental conditions to detect health threats during the cleanup after the attack. After Hurricane Katrina in 2005, the public health workers and other disaster relief agencies tirelessly provided emergency services. Teams were dispatched to conduct surveillance for illness and injury among people who evacuated to shelters and other places of refuge after the storm. Emergency preparedness has evolved from biological warfare in the Middle Ages to coordinated public health responses after events like 9/11 and Hurricane Katrina. The last lens we look through as we view public health history is prevention and policy. Public health works to protect and improve health, not just by responding to disease outbreaks or preparing for natural or human-made disasters, but also by implementing policies that support these efforts on a societal level. During 2000 to 2004, cigarette smoking was reported to be responsible for $193 billion in annual health-related economic losses in the United States. Laws banning smoking in the workplace and other public places have been developed to encourage smokers to quit while protecting non-smokers from the effects of secondhand smoke. Finally, more than one-third of U.S. adults and approximately 17% of children and adolescents aged 2 to 19 years are obese. Efforts to highlight fat, sugar, and salt content in food through labeling regulations have been developed along with the promotion of physical activities in schools, workplace, and neighborhoods. Public health has also had to reckon with ethical failings and systemic injustices. To demonstrate how we advance in public health, we must acknowledge and recognize the historical events that contributed to the public health field alongside its harm to marginalized communities. The Tuskegee Syphilis Study. This study supposedly was to observe the progression of untreated syphilis, a sexually transmitted infection caused by bacteria, occurred between the years of 1932 to 1972. Tuskegee community members participated in this study aware of it, but thought it was a special government healthcare program. In this study, researchers did not collect informed consent from participants and did not offer treatment even after it was easily available. This study sparked national outrage and led to stricter ethics rules for research. The use of HeLa cells. Named after Henrietta Lacks, a mother of 5 visited the Johns Hopkins Hospital, one of only a few hospitals to treat poor African Americans complaining of vaginal bleeding. She was diagnosed with cervical cancer and began treatment. A sample of her cancer cells retrieved during a biopsy was sent to a nearby tissue lab without her knowledge or consent. The lab discovered that Mrs. Lack's cells doubled every 20 to 24 hours, unlike other cell samples that would die quickly. With this discovery, Mrs. Lack's cells were used to study the effects of toxins, drugs, hormones, and viruses on the growth cancer cells without experimenting on humans. The story of Henrietta Lacks illustrates the racial inequities that are embedded in the research and healthcare system in the U.S., raising concerns about consent, race, and ownership in medical research. Redlining and environmental racism. Another example of systemic injustices and imbalances that continue to impact our marginalized communities today. From the 1930s, Black and brown neighborhoods were systemically denied mortgages and exposed to pollution, poor sanitation, and lack of healthcare access, contributing to the higher rates of health risks and diseases such as asthma and lead poisoning in communities of color. In the HIV/AIDS epidemic in the 1980s, early responses to the epidemic largely ignored the Black and brown communities, leading to targeted public health campaigns, but disparities in care and prevention of HIV and AIDS remain. Lastly, the ongoing Flint water crisis is a clear example of the everlasting harms done unto a city of majority Black individuals. This crisis became a symbol of environmental racism and neglect of marginalized communities. Public health problems are diverse and can include infectious diseases, chronic diseases, emergencies, injuries, environmental health problems, as well as other health threats. Regardless of the topic, we take the same approach to a public health problem by following 4 general steps. First, we ask, what is the problem? In public health, we identify the problem by using surveillance systems to monitor health events and behaviors occurring among a population. After we've identified the problem, the next question is, what is the cause of the problem? For example, are there factors that might make certain populations more susceptible to disease, such as something in the environment or certain behaviors that people are practicing? Once we've identified the risk factors related to the problem, we ask, what intervention works to address the problem? We look at what has worked in the past in addressing this same problem and if a proposed intervention makes sense with our affected population. In the last step, we ask, how can we implement the intervention? Given the resources we have and what we know about the affected population, will this work? As we go through this course, you will see different examples of this public health approach at work. To implement the public health approach, practitioners use and apply scientific methods. These methods come from a series of core sciences that provide the foundation. These sciences include public health surveillance, which we use to monitor a public health situation. Epidemiology enables us to determine where diseases originate, how or why they move through populations, and how we can prevent them. Public health laboratories support public health by performing tests to confirm disease diagnoses. Laboratories also support public health by conducting research and trainings. As we continue to move from the use of paper documents to electronic health records, public health informatics continues to increase in importance. Informatics deals with the methods for collecting, compiling, and presenting health information. It enables us to use electronic data effectively when addressing a public health situation. Prevention effectiveness is closely related to public health policy. Prevention effectiveness studies provide important economic information for decision makers to help them choose the best option available. Together, these 5 core sciences can help us promote and protect the public health by giving public health practitioners the answers they need. Public health is better able to respond to the situation by using contributions from each of these sciences. One science alone cannot answer the questions and provide a solution. It is the application of these core sciences together. Let's look at how the public health approach can be applied in an historical example of an infectious disease. During the early 1800s in London, cholera, a fatal intestinal disease, was rampant, causing death to tens of thousands of people within hours of the first symptoms. At the time, which was before bacteria and viruses were recognized as the cause for many diseases, popular opinion held that cholera was caused by bad air coming from rotting organic matter. John Snow, a physician during that time, had a different opinion of cholera. He believed that the illness was spreading by way of a contaminated water supply because sewage was routinely dumped into the river and cesspools near towns' wells. Because of this work, tracing the source of the cholera outbreak, he is often considered the father of modern epidemiology. His research changed the way we look at diseases today. Now, let's apply the public health approach to Snow's research of the cholera outbreak. What is the problem? Snow conducted public health surveillance by looking at where those with cholera lived in London. He saw that larger clusters of the cases were occurring in specific areas. The red circle depicts the neighborhood in question, and the black dots represent the deaths from cholera. Notice the higher density of deaths around Broad Street. In tracking down and interviewing cholera victims and their families, Snow geographically mapped the outbreak. His efforts highlight the benefits of linking scientific inquiry with engagement of community stakeholders and shared ownership for health. Next, he examined the data and tried to identify risk factors. That is, he tried to determine the cause of the deaths by using the patterns of where cases were occurring. This slide illustrates the location of the water pumps, which are indicated as black boxes. On the basis of his previous work, Snow believed that water was the potential cholera source. The map reveals that the largest number of cholera cases occurred in the areas near neighborhood water pumps. This observation prompted Snow to further research the distribution of water pumps in London. He identified where people who had cholera were drawing their water. His findings indicated that clusters of cholera cases were more commonly located around certain pumps, particularly the Broad Street pump. Through his research, Snow concluded that drawing water from the Broad Street pump was a primary risk factor for becoming ill with cholera. After identifying likely risk factors, the next step in the public health approach is evaluating potential interventions. What interventions will work? With the water supply from the Broad Street pump identified as the risk factor, Snow then worked to identify interventions to address the problem. Through continuous research, Snow understood that the interventions required to control the cholera outbreak needed to stop exposure to the contaminated water supply and, on a larger scale, stop exposure to the entire supply of contaminated water in the area. Using the final step of the public health approach, Snow implemented the intervention by removing the handle from the Broad Street pump so no one could continue to draw water from the contaminated water supply. After a long battle with the politicians and water companies, he finally convinced the British government that water contaminated with sewage was the source of cholera and other diseases, which resulted in the implementation of policies and laws for water sanitation. Public health is guided by three core functions as outlined by the Institute of Medicine. 1. Assessment, knowing what needs to be done. 2. Policy development is being a part of the solution. And 3. Assurance is making sure it gets done. These functions are supported by the 10 essential public health services, including monitoring health, investigating health problems, educating the public, developing policies, enforcing laws, linking people to services, and evaluating effectiveness. These services are not a prescription for what public health agencies should be doing. Instead, they are intended to serve as a descriptive tool to capture the field of public health and to communicate what public health provides. The core functions, assessment, Policy development and assurance must be carried out at all levels of government, federal, state, and local, for the overall public health system to function effectively. Looking at tobacco use, here are a few examples of each function at the different governmental levels. This foundational public health services framework illustrates a minimum package of public health capabilities and programs that no jurisdiction can be without. This was updated in 2002 to ensure it reflects the evolving nature and modernization of government public health. This outlines the unique responsibilities of governmental public health and can be used to explain the vital role of governmental public health in a thriving community. Also to identify capacity and resource gaps, and to determine the cost for assuring foundational activities and justifying funding needs. However, to best serve their communities, health departments will provide additional services and may require additional capacities in different areas. Let's look at the roles of stakeholders in public health. Public health is a team effort. Partners in the public health system includes government agencies, healthcare providers, community-based organizations, educators, policymakers, and the public. Everyone has a role to play in promoting health. Healthcare plays a vital role in protecting and promoting the public's health along with public health organizations. The two have differences that are worth highlighting here. For example, public health focuses on populations, while clinical care focuses on the individual patient. Healthcare and public health are complementary. When they work collaboratively, all people benefit. What determines the health of a population? According to the CDC, these include genes and biology, such as sex, age, and genetic makeup. Health behaviors like smoking, eating habits, and physical activity. Social characteristics, also known as social determinants of health, such as income level and education level. Physical environment, where a person lives, work, and play. And lastly, access to health services such as quality healthcare and insurance coverage. This chart is an estimate of how these four major determinants influence health at the population level. Notice the portion of the chart that represents medical care. We spend trillions of dollars on healthcare, yet it only determines about 25% of our health. The remaining 75% of what determines our health as a population is our total environment or ecology, including the social environment in which we live, plus our health behaviors and to a lesser extent, our genes and biology. An example of the role these determinants play in our daily lives is through nutrition and physical activity. Both are essential elements in producing optimal health and should be viewed in the context of such environmental factors as social and cultural norms that influence food choices and physical activity, environmental characteristics such as availability, and sector influences such as the marketing of processed food. All of these factors influence our individual choices, which in turn influence our overall health. To address the determinants on the slide we just discussed, we have to have a plan of attack or a means to affect change. This health impact pyramid helps visualize which public health interventions have the greatest impact. Those that change the context to make healthy choices the default tend to be the most effective. As we move down the pyramid, the public health impact grows greater. However, as we move up the pyramid, the amount of individual effort increases. Starting at the top, we can do counseling and education, perform clinical interventions, have longer-lasting preventive interventions, change the context in which people operate so the default decisions they make are healthy, and lastly, positively influence socio-economic factors. A point to emphasize here is that we have to have trade-offs. We have to sometimes give up resources in one area to have a larger impact in another. Let's take a look at some examples. This pyramid illustrates the impact of different types of public health interventions. Let's start at the top of the pyramid and work down. Counseling and education, in clinical and other settings, is regarded by some as the essence of public health action. but unfortunately, it is not as effective as we would like. That being said, at times, counseling and education are the only forms of intervention available, and when applied consistently and repeatedly, can have an impact. Examples include warning labels on cigarette packs and campaigns to promote tobacco cessation. Moving to clinical interventions, ongoing medical care for a health condition is an example. In the case of cardiovascular disease, these interventions can have a considerable effect. However, we are limited by a lack of access to certain patients who need care and lack of adherence to medical instructions in the real world. Long-lasting preventive medicine interventions, vaccines for example, prevent 2.5 million deaths among children around the world every year. In this case, a single dose or instance of an intervention can have a lifelong effect. We make health decisions the default by changing the context in which behaviors occur, making it difficult to avoid the intervention. For example, changing the laws to require seatbelt use in cars and banning smoking in certain public spaces have had substantial impact. At the base of the pyramid are public health interventions that affect socioeconomic factors. If we can improve quality of life by helping people out of poverty, providing basic sanitation, improving their access to education, healthy food, and medical care, we can greatly improve a population's chance for a healthy lifestyle. Now let's look at the existing divisions in the Minneapolis Health Department. The Environmental Health Division conducts inspections and investigates outbreaks. On average, 7,000 health inspections are conducted each year. Some businesses that they investigate or inspect are food businesses, hotels and motels, public pools, body art businesses, laundry and dry cleaning businesses, and tanning businesses. The Policy and Healthy Communities Division advocates for policy and connects residents to health programs. Next, the Public Health Initiatives and Operations Division. They focus on areas like emergency preparedness, maternal, child, and adolescent health, opioid prevention, and research. This division builds a foundation of public health that supports the department's strategic goals. Teams in the Sustainability, Healthy Homes, and Environmental Division educates residents on the health impacts of the environment and ensures environmental justice through support and engagement of Minneapolis's most vulnerable communities. And lastly, we have the Public Health Infrastructure and Organizational Development Division. This division supports equity, anti-racism, and strategic development across the department. That completes the Public Health 101 training. Thank you for being here.